opportunity to be here to speak with all of you today. I want to thank Jenny and Chris and Nicole for that opportunity. Are you guys excited?
Yes.
Are you guys having fun so far?
Yes.
Do you feel energized?
Yes.
Passion drinks? Okay. How about Eugene Hong? Was that not an amazing PH demo? And of course, Dr. Angie Cross. I learned so much from Dr. Angie, and we're so blessed that Yoli put together a doctor's advisory panel with doctors like Dr. Angie on there to give us so much great information and to help us lead the way. So, what I was hoping to do today is give you some more information about digestive health. Does that work for you?
Yes.
All right. I have some notes here to make sure that I stay on track for you guys. So, when we look at digestive health, what is the purpose of your digestive system? Okay, the purpose of the digestive system is to take the food that we put in our body. Now, everybody in here puts the perfect food in your body, right? Yeah, right? I have 6 children. I happen to know that I think it's nothing short of a miracle that their bodies, their digestive system, is able to take whatever food you put into your body, to break it down to its smallest particles, to then absorb that food, and then you allow your body to utilize those nutrients to do everything it needs to do to keep you healthy. So putting the perfect food in would be great, but most of us don't do that. So when we're looking at that, we want to make sure that we respect the fact that our digestive system is doing that. So that's what it does normally. If your digestive system is working properly, understand that it only absorbs certain things that are good for it. So it is very selective in what it allows to be absorbed. It doesn't allow everything. Now that's when it's working perfectly. More often than not, from my experience with my patients, the digestive system isn't always working perfectly. Now what would cause that? What would cause your digestive system not to work correctly? Well, sometimes medications, like antibiotics or antidepressants. Sometimes pesticides that can get into our body, like glyphosates. What about chloride? Fluoride, I should say, fluoride. What about artificial colors, artificial flavors, artificial preservatives, artificial sweeteners? All of these things can do damage to your digestive system. So that then presents a challenge for your amazing body, and God made it work so perfectly. But that's a challenge that your body has to overcome in order to take in the proper nutrients. Do you agree? Can you see that?
Yes.
All right. I love your enthusiasm back there. All right, I really do. So when our digestive system isn't working perfectly, there's a name for that, and it's called leaky gut. And what it means is that where your digestive system, specifically your small intestine, should be selective in what it allows to be absorbed, it can't do it that selectively anymore. So it allows things to be absorbed that shouldn't. Let's think about that. You have stuff in your gut. Visualize this with me, guys. It's supposed to come out the other end. Okay? Go there with me. It's supposed to come out the other end, and instead, you have leaky gut. So it's going to be absorbed into your bloodstream and get into your body. Do you think that causes inflammation? Dr. Angie was just telling us how inflammation is the cause of most health problems. Can you see how that can come from the gut? Okay, so inflammation, major cause of health problems, and leaky gut can really contribute to that. Let me give you an example of something that I see all the time in my office with my patients. In your gut, there is a balance between bacteria and yeast. Dr. Angie just told us that sometimes antibiotics can get into our system, right, through foods. Right? We all got that? All right, good, thank you. Okay, if antibiotics get into your digestive system, understand they don't know the difference between good and bad bacteria. They might wipe out the good bacteria. So what happens? Yeast flourishes. Guess what yeast lives on? Yeast lives on sugar. Does anybody in here know someone who craves sugar, or just me? Okay? Anybody know people who, when they eat food, they feel bloated? Okay. Yeast secretes poisons, and those poisons can get absorbed into your body. Anybody know people who get headaches? Okay, those toxins can cause headaches. Those toxins cause an inability to focus. Do we know anybody like that? Don't start elbowing your neighbor, guys. Okay? We don't diagnose, we don't point fingers here, okay? All right, so it can cause an inability to focus, an inability to concentrate. Yeast, or I should say our gut, detoxifies through the skin. Know anybody who has acne, psoriasis, eczema? Okay, that's a gut issue. And if you think about all of those things, all of those different symptoms, headaches, inability to focus, skin issues, bloating, gas, all of these things, craving sweets, can be tied to your gut. Everybody got that, right? Unbelievable how our gut plays a role in our health and in everything else. And remember what Dr. Angie said about inflammation. Let's look here. Eugene did an amazing demonstration with looking at acid. So if I took a can of Coke, do I have a volunteer to go run outside and pour it in the nearest car that you see out there? What's the main ingredient in Coke? Acid. Okay, we see how acidic things are. What happens with acid? I'm just tying together what Eugene and Dr. Angie said. When we increase acid in the fluid that bathes our cells, what your body has to do is it has to try its best to buffer that. So what it does is it pulls minerals out of your bones and out of your muscles. Can you see how that weakens your body? The next thing it does with the excess, it has to prevent it from damaging your body. So where does our body put toxins to protect the body? Fat cells. So people get fatter and people get weaker. When you increase acidity, you increase, I'm a chiropractor, you increase inflammation. What do you think happens at the joints? Pain, inflammation. When you increase inflammation, what do you think happens to blood pressure? You increase blood pressure. When you increase acidity, what happens to blood sugar? The sugar cannot get from the blood into the cells. Blood sugar stays higher. When you increase inflammation and acidity, what happens to oxygen delivery at the muscles and at the tissues? Oxygen saturation decreases. So any athletes in here? Okay. Anybody like to exercise? Okay. If you're acidic, you're decreasing your oxygen delivery to the cells. So can you see how acidity, all those drinks that Eugene showed us, how those can harm our health? Yes? All right, guys, we're getting there. He's got me on a time limit. I'm hurrying. Okay. So how many of us want to solve this health problem? And we understand there's gut issues and there's problems with pH, and we want to solve it. What do you think? I'm having a good roar for this. What do you think is the solution? What is it? Yoli. And I'm going to explain to you why, Yoli. We're looking for a solution, and this is it. It's Yoli. So why, as a chiropractor and a dietitian, would I put my name behind Yoli? Why would I trust Yoli? There's one simple answer, and it's results. Anybody in here want results? Yeah. I'm going to tell you something I don't tell many people. I'm originally from New Jersey. I worked at University Hospital, our Jersey people in here, and I worked in trauma, okay, as a dietitian. Okay, you know why I worked in trauma? Because when you try to change somebody's diet, it is so difficult and so frustrating. I'd rather work with comatose people. The trauma surgeons trusted me. I'm like, give them this. I'll write the orders, you sign it. Because it's hard sometimes if you just say, eat this and don't eat that and blah, 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 blah. Yoli solved that problem for me. Why did Yoli solve that problem for me? Because they came up with a system, a guideline that tells you exactly what to do. It tells you, and we know it's a health gain system. Yoli is not a weight loss system, right? I have people that I use it to gain weight. You can gain weight, you can lose weight. The bottom line is you're balancing foundational health by correcting nutrition, and it's brilliant because the system has products in there that work synergistically. You heard Dr. Andrew say it. They work synergistically together. It's not a mishmash. They are working together to give you optimal results. And you're eating real food. Okay, you're not wondering what you have to eat. You know exactly what to do. You're eating real food and you're going to get real results because of that. So, if I had to tell you the main reasons why I think we are set apart from any other nutritional supplement, besides that there's a money-back guarantee, which I don't think you ever hear that anywhere else, right? Number one, there's a system. And that system is very easy to use and very clear, and it works if you follow it, right? You know, if somebody's not getting results, typically it's something that they are doing wrong. And we as health coaches are there to help them fix that, right? Yeah. Health coaches in here? Okay. The next thing that mainly sets it apart, let me just go through real quickly. 2 parts to this, and then I'm going to be finished. We talked about how bad the acid is. So let's just reiterate why alkali is so important, because it alkalizes. As a foundational nutritional product, we want alkali. And then to support our lifestyle, we want to make sure we're having the pH 2.0 and the fun that have alkali in it. But when you're looking at that, so what is alkali going to do? What is alkalizing going to do? It's going to suck the fat, the acid I should say, out of the fat cells, right? So people get thinner and lighter. It's going to preserve and protect the minerals that are in the bones and the muscles, so you're correcting the structure. Does that make sense? You with me? So you're stronger and you're thinner. It's going to decrease acidity, so it decreases inflammation. So what about joint pain? All of my patients, joint pain. The pain diminishes. If you decrease inflammation, what happens in your blood vessels? You decrease blood pressure because you're decreasing inflammation. What about blood sugar? When you alkalize, you change the structure of the insulin receptor. So you take blood sugar that's high and you deliver it into the cell more effectively. So blood sugar improves. And lastly, with that, when you alkalize, increase oxygen saturation at the tissues and at the muscles. So for an athlete, or for any of us really, I'm not an athlete, but I like to perform too. Guess what? You are allowing the muscle not to fatigue, but to function longer and recover better. Does that make sense? Yes. Okay, can I give you one last example? Yes. All right. I already told you, how does our body buffer acid? It pulls minerals out of your bones and muscles, right? Okay, let's think about this, and then we're going to end with this. Take a pencil and a diamond. A pencil tip is graphite. It's made of carbons. A diamond is made of carbons. A pencil point and a diamond are made of the same thing. Do they have the same value? No, why? Why is the value different? They're still made up of the same thing. Thank you. The structure of those carbons is what's different and what sets a diamond apart from a pencil. Alkali is a bunch of minerals. You can get that anywhere. But you won't get alkali anywhere because the structure of the minerals in alkali is what sets that apart. You will not get that anywhere else. Are we psyched to have that? Yes.